Physical therapy is listed as an essential component of healthcare during the coronavirus pandemic, but a lot of facilities are still taking preventative measures to protect their patients and their employees by going virtual. MedStar is one of them, and joining us now to talk more about their video visits, MedStar physical therapist Liz Rothermel. Good morning to you.
Good morning.
I'm curious about how this works with these virtual visits when it comes to something like physical therapy, which is typically so hands-on.
Absolutely. It's been a challenge for us because this happened very quickly, but we tried to do what was best for our patients so we can continue to serve them. Clearly we love to be hands-on. We love being with our patients. We love watching their movement, doing things that, we can do right with hands-on to make them better, but that hasn't always been an option now with the video visits. The great thing is, though, we can still connect with our patients. They know we're here for them. We can answer questions. We can demonstrate. We can have them show us their home environment even, so that we are really maximizing their independence, their function, and still getting them better even though we can't be right there with them.
Obviously, with physical therapy, it could run the gamut. Anybody recovering from hopefully a short-term injury to somebody with a long-term disability, really could be anything, and the levels of severity are all over the place. So as far as the virtual visits, are there some that you can assist more than others?
Sure. It's what we're needing to use now, but of course it doesn't work for everyone. And we are still seeing a couple of patients in the clinic who are high priority and low risk, those that really need our hands and we can do it safely. But for those that we need to do video for, some they are very independent. They can follow their exercise program we give them or send them videos and pictures. Some do need more hands-on, or in terms of safety, someone like a balance patient or a neurologic patient, it may not be safe for them to be doing certain exercises without us right there. So we have to be very mindful of that when working with our patients as well.
How about the correlation between people's mental focus and the physical when it comes to all of this? Because I know I have loved ones who, quite honestly, would not go unless they were forced to go. So if they're at home, is it more of a challenge perhaps to make sure that people are doing this?
Sure. I think it always is somewhat of a patient's motivation level in terms of getting better. With everything going on, being out, being active is just so important for our overall well-being that I think therapy is a great outlet to talk about that. So maybe it wasn't someone that was as active before, but now, we're forced to find new ways to do things, and getting out can really just generally make us feel better physically and emotionally.
Well, I think you're absolutely right. Learning new challenges as we go and ways to combat those challenges. There's the information if you're interested in MedStar's Health Physical Therapy. Elizabeth, thank you so much for joining us. Best wishes and stay healthy yourself. We appreciate your time.
Thank you. Be safe.